Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts and learn how to craft your ideal birth. We will tackle the scary and weird questions that come up along the way and provide answers that are driven by science and evidence-based recommendations. I'm going to show you how to redefine parenthood and choose what's best aligned for you and your goals. With 10 years of experience in family education and a master's degree in human development and family studies, I'm ready to help you navigate pregnancy and explore your birth options to free yourself of fear surrounding childbirth. My goal is to help you have an informed and confident labor experience, plus an empowered and joyous postpartum. Hello, have you heard about my completely free class that teaches you 6 evidence-based ways to avoid a C-section and reduce your tearing in labor by up to 50%? And remember, I mentioned it was completely free. This class is going to teach you how to advocate for your preferences in the birth room so that you can have a birth that's filled with joy and not birth trauma. Advocating for yourself starts with being empowered with the right information so that you can ask the right questions and confidently make decisions during labor based on what feels good to you and your baby. But here's the thing. The U.S. has one of the highest C-section rates in the world, and it is ever climbing year after year. And it's not because the system is broken, albeit it is, but it's really because women don't have the tools to navigate that broken system. We may not be able to change the system before you have your baby, but what we can do is change how you operate within that system. Change the conversations that you're having with your providers. Change the places that you are getting your information to help you have informed conversation with your doctor before you have your baby. I want to teach you how to do that. We know the reasons that our C-section rates are climbing. We know the reasons that inductions happen so often, and we know the reasons that babies end up in the NICU. I want to help you avoid all of that so that you can have a birth that you love. You can find my free class at thebirthlounge.com/C-section so that you can learn 6 evidence-based ways to avoid a C-section and reduce your tearing in labor. Again, that is thebirthlounge.com/C-section. See you there. Bye. Lara, welcome to the show.
Thank you so much. I'm so excited to be here.
I'm so excited to have this conversation. Mastitis is a topic that doesn't actually get a lot of light until you experience it. I feel like not a lot of people know about mastitis until they actually have it. And so I'm excited to get the word out. Also, protocols for managing mastitis have recently changed. I want to talk about what that change is, and are we seeing it be successful or are we seeing it be unsuccessful? What does that look like? But before we do all that, you're in Canada and I'm in the US, and a lot of our listeners are, abroad somewhere else. So today's topic is a general topic, but what is said today, we're going to try and keep it general as well, but some things are going to be specific to the Canadian practice. So make sure as you're tuning in, you're listening for, we'll try and note like this is specific to Canada, and I'll try and share what we do in the US as much as my knowledge holds. But make sure that you're looking up specific protocols and things in your region of the world to know what is applicable to you, right? And Lara, do you see people beyond Canadians, or do they need to live in Canada to receive services from you?
For services, I have an online course. It is specific to Canadians, not limited to, but very specific to our healthcare system for the prenatal course that I offer. But lactation services, because I'm a registered nurse, it is based off of jurisdiction. So you'd have to be Canadian.
Perfect. Cool. All right. Just to get that disclaimer out of the way. All right. So I think let's start with the very basics of what is mastitis.
Yeah. I mean, honestly, and I think you nailed it already. Just, you don't get it until you get it.
Yeah.
When you do, you're like, I wish I did not understand.
Yeah. Don't want to be in this club.
No, it is no fun. And it's really crazy, honestly, because it comes seemingly out of nowhere for people. And it just feels like a train has hit you and you got the fever and the chills and the aches and your heart rate's up. And it was a big thing through our whole COVID pandemic, especially because people were like, do I have COVID or do I have mastitis? And it was really difficult without the other, kind of sinus or cold symptoms. When that first initial fever hits you, you're not really sure which one it is. But mastitis is basically one of two things. It is overarchingly an inflammatory process that happens in breast tissue, but it could be either just an inflammation process or bacterial, which is very much something that I find is hard to get away from, because everyone's like, oh my goodness, I have mastitis, I need antibiotics right now or I'm gonna be done. And that we're finding is not so much the case, thankfully.
Okay, tell us the difference between bacterial and inflammation. How would you acquire the bacteria that cause that versus what causes just inflammation?
That's the fun part, is they don't have concrete information on that quite yet. There's a correlation with nipple damage, but they're not actually saying like nipple damage causes that. It's such an external thing, and the bacteria that ends up coming into the breast or being in the breast, it's usually what they find is like, or what they're saying is, the inflammation starts the process. If left unchecked and it kind of continues, then because of the inflammation and the stagnancy that can happen in the tissues and all that, then you can be at a higher risk of it developing into bacterial mastitis.
Yeah, into an infection. Okay, so what I'm hearing is that not all mastitis needs antibiotics. Sometimes it's going to be addressing the inflammation. And I think that's kind of what the new protocols show, isn't that right? Okay, well, before we dive into that, let's talk about what the signs and symptoms are of mastitis. How do you know if you have mastitis?
So right off the bat, I kind of had said it, but your fever, your chills, and pretty much inflammation. It's redness in usually a very specific area of the breast. So like in our first days postpartum, you get the engorgement. Sometimes you get like that shiny skin because it's so taut where everything is swollen, but it's on both sides and it's pretty even. This is a little bit different because it's usually pinpoint, like one of the four quadrants, and there's a hard red area that hurts. So it's pretty like in your face obvious for the most part. It can start a little bit more mild and it can feel like I don't know, more like in a really sore achy spot. Or some people think that when you get like a milk duct plug, I always end up saying duck, but milk duct plug, it's really interesting because like then, some people's minds are like, oh my goodness, this is going to be mastitis. And then they start into all of what our old protocols said, which is the total opposite of what we ideally should be doing to prevent it. So a lot of what the protocol says to do for treatment is actually a lot of preventative things that we can do to avoid it to begin with. But it is the fever, the aches, the chills, the feeling like a truck hit you and there is a sore red spot or a sore spot somewhere in your breast tissue.
What about being hot to the touch? A lot of our people who have experienced mastitis will say that spot is hot to the touch.
Totally. Yeah. And that kind of comes along with that redness. So I guess like the inflammation process that happens there, it feels quite warm and like very differently warm than other parts of even the same breast would.
Okay, so once you kind of get the inkling that you have mastitis, what are first steps? What is the old protocol? Let's talk about what we used to do, because it sounds like that's what a lot of people still do. And then let's talk about what we should be doing instead and why.
Totally. So everybody hears it, and I still see it all over the mom groups on Facebook and everything. Like the second that you get anything going on, just big amounts of massage, pump like crazy, have that baby feed on that breast, make sure that you're, using a hot shower, massage, or like the vibrators or the breast massage tools or anything. And people are like digging into their breast tissue like crazy. I have had people show up at my office and they're like bruised like crazy, and they're just, oh, it hurts so much. And we actually are doing kind of the polar opposite of what is helpful, because there is so much. I mean, a breast is an organ, right? So just like if it was a kidney, just like if it was a bladder, just like it was anything else, we need to handle it with care and be fairly delicate. So I usually say, like, no more pressure than what you would wash your face with if you are handling your breast, because the chances of you increasing inflammation and how many like microscopic little ducts there are, and the very intricate way that the breast tissue actually works and the hormone response and all this stuff, there's so much to it, and it's really easy to disrupt it, especially if, you know, you're maybe a first-time parent. This is your first time having to deal with making milk. It's like, oh my goodness, this is a totally new thing. It's a new thing for your body. And we have a tendency of like, oh, there's something there, I'm going to squeeze that out. There's no squeezing out milk blockages or ducts. And, you know, one of the kind of neat things that they talk about in the new protocol is that there is such a small chance of there actually being like one blocked duct, because it's such a massively interworking system, and like there's so many connections and there's so many different tubes. It could be one little area that you might have a little bit of a backup in, but having that extra inflammation, like you're really working in and around all of these little tubes, and the more inflammation in the tissue around it, the more you're actually going to block off. So you can increase your chances of mastitis by doing all of the things that we used to do.
Or even making it worse if you do have like the very first kind of onset symptoms and you do that, you're only exacerbating what's already there, just, kind of speeding up that process and or tipping you over into that category that now you do need antibiotics, where otherwise you would have been able to avoid them.
Exactly. That early intervention piece of it, and even prevention, is such a huge deal of being able to avoid it. I mean, ideally we address all of the underlying issues that we have anyway. We don't just treat surface level, right? Like that's kind of at least my theory on things. I don't really want to treat what's going on in front of me. You want to prevent things from happening in the future. So it's a big deal to be able to say, like, oh, okay, cool, I now understand that this is a totally different type of process. There's not like one block in there. There's one swollen little sack of milk that I have to get out. It's an entire like intricate little network, and there's just swelling in and around some tissue. But it is usually pretty localized to like one spot. But it can expand too, and especially if it goes from that inflammation to like a bacterial infection, that's where you start to get a lot of expanding through, and it can go into abscesses, and it can get into like your whole breast at that point. So there's a lot of damage that can be done for sure.
Yeah, it's really important to have mastitis treated. It's not something you want to ignore or assume that it will go away on its own. But what I'm hearing is just be very intentional with how you resolve it and make sure you're doing what your breasts are needed. Okay, so what is the new protocol?
It's pretty intense, but super easy. So kind of a little counterintuitive, I guess, in saying that. But like the very first thing, and I love that they put this, is straight up just reassuring people that this is a normal process that can happen. Your anatomy is going to fluctuate. Some people are more prone to inflammation. It actually even describes in one of the steps that if you have perinatal mood disorders, that you are more likely to have exposure or increased risk of having mastitis. So it's a really fascinating and very intricate way of looking at it, because I mean, we have to holistically look at our bodies, right? It's not just this is a breast, this is the one thing we're going to treat. Like everything is connected. So if your nervous system is in this constant fight or flight mode, your cortisol levels are going to be higher, your inflammation process is going to be higher, right? So it actually totally makes sense that having anxiety and depression would potentially increase your risk. So having the perinatal mood disorders can actually increase your risk of things like aversions to nursing, which makes you not actually want to nurse as often, or maybe you're pumping more, and pumping in and of itself, I mean, goodness, people can be so adverse to pumps. I always say, like, at one point with my son, my pump would start talking to me if I knew I was done. Like, it was awful. It is completely expected for you to have periods of engorgement. There's expected periods of you feeling more full than other times, or having some areas of your breast be more full than other times. You know, even having your hand position, depending on where you're keeping your thumb, if you're cutting off certain ducts or putting pressure on certain ones, and that area is having a harder time to drain, then it can actually increase your risk of having kind of some of that inflammation process, or maybe it's not draining properly. So we do know that there's certain things that you can do. Having baby nursing appropriately can be a huge deal. So making sure that their mouth function is working, making sure they don't have any oral like restrictions or ties or anything like that. That's a really, really big help. But when you notice that something is actually starting to happen, so maybe there's a spot that gets sore, maybe you're like, ooh, I've got a blocked milk duct there, which we now know is not actually just a duct. The biggest thing that people do is like, oh, I'm going to empty that out. I'm just going to work at it until I get it out. And everybody produces milk very different. Some people will actually see like globs of fat of milk coming out at certain points, but not everybody has that either. So what you want to try and avoid doing is overstimulating that breast, because if there's already inflammation there and those little teeny tiny tubes are narrowed, you're not going to be able to force something through it. You're actually going to increase the amount of inflammation that you have there. So the more that you increase the amount that you're pumping, the higher your milk supply is, because our bodies are freaking brilliant and want to produce what our babies need. So if our body's being told, make more milk, we will make more milk. But the idea is, don't empty it out. Don't continue to pump. Don't only feed off of that side, because you're not allowing for that time for your body to kind of reset and reduce that inflammation. So when you have the option, just use the other side, use that one appropriately, and like switch off, just nurse exactly as you usually would. Ideally, you're avoiding pumps, you're avoiding nipple shields, and your baby is nursing. Now, if that's not the setup that you have and you're not actually nursing, then, you know, they say there's no need to over sterilize parts, because you're not going to catch bacterial mastitis. Still keep clean, like proper hand hygiene and all that stuff still applies, but you'd be doing that anyway. So it's not any extra huge thing. There was a thing going around about it being caused by yeast. That's not something that they're able to confirm, and it's not something that they're saying is an issue. So it's not a matter of like sterilizing all of your parts all of the time, or baby toys or anything like that. It's not quite the same thing as if you were dealing with thrush. There is a difference in that. But making sure that if you are pumping, your flange sizes are actually appropriately sized, which is a huge deal. It is something that I run across constantly. There is always issues with people. Like, I got a pump in the mail as one of my baby shower presents recently, and it had a size 30.5 and a size 28 as the standard nipples that are standard flange sizes that it came with. I have not one person in my career at this point that had a size 24 millimeter like nipple, and she was super stinking swollen. Like, oh, this is not how this is gonna go.
Oh my goodness. So why do you think they do that? Is that in order to make you buy additional flanges, knowing that the most common size is much smaller than that?
I wish it was, but like these companies don't even offer smaller flange sizes that are appropriately fitting in a lot of cases. Like even some of the really big brands, you have to buy the aftermarket ones to fit the pumps. Like I have all these little inserts that we get from Amazon, or pumps, flanges from other companies. But man, there's like 24 millimeters is what they use for cows. Like we're not freaking cows.
Oh my goodness. Okay, what is the standard flange size that you kind of see? What's the like average?
Well, that parts come with. So a lot of the big pumps or like the flanges will be sent, and like the smallest that you get in the packages are like 21 or 24 millimeters. But I mean, honestly, one of the most common sizes I fit somebody for is a 13 or a 15 millimeter.
Oh.
So like way smaller, way,
Wow.
way
And they're
smaller.
sending 30. They are sending double. What?
Yes.
Like, that's
And
borderline
I see
offensive,
it.
okay? What are you trying
Oh
to
no,
say
it
about our
is.
nipples?
Entire areola fits in that. Like, come on, we don't need that. We're not like, oh, it's so brutal. But people will get pain, and I see in the hospital they'll be in so much pain while they're pumping, and they'll send them home with these size like 28 and 30s, hoping that that's going to fix the pain, but it doesn't. And then we get in here, do a proper flange fitting. It's like, oh, size 13. Hey, look how much extra milk you're putting out. Plus, it's super comfortable. Like, it shouldn't hurt. So it's a huge pet peeve of mine. But if you're pumping and have this equipment, you need to have something that is fitting your body properly. And that really does end up making a big difference, because if you're increasing, you know, the amount of pain that you're having, pain can equal inflammation. And if you're going to be pulling, like the amount of suction that we use, and some people will go and they're like, you know what, I'm just going to crank my pump as high as I possibly can and put out as much milk as I possibly can because my setting's on the highest. Well, it actually is, again, super counterintuitive. So looking at it from a mastitis perspective, you know, the smallest amount of suction while you're actually getting milk out is going to decrease the amount of inflammation that you get. So having a proper fitting flange and only using the suction that you need in a pump are really easy ways to be able to help decrease pain and inflammation and potential for like nipple damage and all kinds of stuff. So there's ways of making things comfortable, and just because it is comfortable doesn't mean it's not effective. And I feel like the pain Olympics kind of comes into play here. Like, well, if it's not hurting, it's not working, you know?
Oh
and
my.
I don't agree with that in the slightest.
No.
So
No, not at all. Okay, so we're not massaging, we're not pumping, we're just feeding baby as normal. Hand expression if you still feel full after feeding baby, or no, we should leave that milk as to not add to the inflammation.
It's a little bit tricky because it depends a bit on how early in your journey you are as well. Because I mean, ideally, you're only taking out what you need to. There's this thing called a feedback inhibitor of lactase, and it's this, they call it fill. So when you're full, you release fill. And when you're engorged, your body is actually releasing this thing that's like, hey, stop making more milk. So the prolactin and oxytocin receptors are blocked. And so it will tell your body, like, too much. Okay, we actually have to calm down. Versus the opposite, if we just keep pumping, it's actually saying, like, oh, no, we need way more. So you want to try and minimize the extra that you're trying to make to try and reduce the amount of inflammation and hardness that you're getting. So basically, like, as minimally to comfort if for some reason baby's not nursing super effectively. But if you have mastitis or if you have that inflammation in there, it's not going to be comfortable anyway. So just like a sprained ankle, we want to do the things that reduce inflammation. NSAIDs, so Advil or naproxen or those kind of things, Tylenol, ice, those are some of the best things you can do. We got the frozen cabbage leaves if you want to whip those out. Like, they're fantastic for some people. But you can use ice every hour, like on the hour for about 15 minutes, and just have that there. People's supplies will be really different coming out of mastitis in some ways. Some people will, depending on how they treat it, I'll say, have either a lot more milk or they can notice a temporary dip. You can always get that back up by expressing again and having that, but your body will need a little bit of time to reset. So it's okay to use ice. It's okay to use Tylenol and Advil. Those are safe and they will actually help to decrease the inflammation. And sometimes just doing those things right off the bat is enough to prevent it from actually reaching the level of mastitis, or definitely ideally to prevent it from going to that bacterial mastitis.
Yeah, okay. And in terms of that bacterial mastitis, if you do need antibiotics, that milk is it safe to still go to your baby even though it has antibiotics in it?
Totally. Yeah.
Perfect.
So with the different lines of treatment, ideal situation is if you are still experiencing those kind of fever, chills, achy, red, swollen symptoms that would come with mastitis after 24 hours of ice, Tylenol, Advil, making sure that you're only pumping until you need to, having a really good supportive fitting bra is a big one. And then you would be seen by a provider and then, potentially given antibiotics. So there's multiple different lines of treatment of it. Ideal situation is that the first one is going to work. So they're oral antibiotics. People don't necessarily need to instantly be hooked up to an IV. I worked in the ER for years and everyone would come in and it was just like, oh, they've got mastitis, get them on an IV antibiotic like yesterday. So that has changed hugely as well. And we know that using therapeutic ultrasound at like a physiotherapist's office or at a physician's office can actually help to decrease inflammation as well. So there
Wow.
are lots of different treatment options for it. With the bacterial, they used to just almost like admit somebody and then do these like IV antibiotics around the clock type of thing to try and help prevent it. But oral antibiotics are actually a pretty good first line treatment. And they have an anti-inflammatory property in them as well. So even if it isn't bacterial mastitis, a lot of people who are just running right away to the doctor and getting these antibiotics are having the effect of it. So it looks like it's working, even if they didn't necessarily need it. It's not quite as common as what we thought. I guess usually the inflammation process is much more along those lines. Now, if it's over 48 hours, ideally you're getting an actual culture to make sure, because if you're being treated with antibiotics and they're not working after about 24 hours to try and help decrease, you got to figure out which one's going to work. So I wish that cultures of mastitis were something that we did a lot more commonly. So you could actually know if that was the case or not, because I mean, we overuse antibiotics in our society so much anyway. So it's would be ideal situation to try and keep everybody a little bit away from them, preventing some of the resistance that happens. But
Yeah. Avoid them if you can.
oh yeah, absolutely. I
Yeah.
mean, they wreak havoc on your gut too, right?
Yeah.
So it's not like they're benign and it's just an easy thing. And especially for people who have recurrent mastitis and they're just
Mm.
treated constantly, like that absolutely should not be the case. Like you should be getting a culture at that point because either it's not being fully treated or there's something else going on. Usually there's an underlying issue that, either there's an oversupply or maybe baby is not feeding properly, or maybe I do see like a lot of the time people are just expressing like crazy and it's not allowing that supply to regulate. So
Yeah. Okay, so when we have antibiotics, it's good to follow them up with probiotics?
it is, yeah, but it's also actually recommended in the protocol that
Oh,
you
wow.
could, yeah, I know, isn't that impressive?
Yeah, I love
So
to
it's
hear that.
not saying that it's definitive. There's not like crazy strong evidence, but we know that there's a really good link with a lot of
Yep.
good stuff happening when there's probiotics, right? So it's the lactobacillus. There's two different strains of it. I'm not going to try and pronounce it because they're ridiculous, but there is the lactobacillus strains of it, and it actually can potentially help as one of the steps of the treatment plan. So it's
Wow.
not even just in response to the antibiotics, it's to help with the inflammation process and what's going on in the breast tissue as well.
That is awesome. Okay, what about sunflower lecithin? We have a lot of people that ask about it. What's the data say about that?
Mm-hmm. It's a bit of a tough one because,
Okay.
like most natural supplements, there's not a whole pile of like solid
Sure.
data on it, which doesn't happen a lot anyway. Um, Anecdotally, I do find that, especially if somebody is like prone to having plug ducts or blockages or something,
Yep.
I personally will recommend it, but I don't use it as like a treatment. Like you don't say,
Mm,
hey, go use this. It's like, here's a temporary solution while we get this figured out to figure out what is the underlying cause of these issues.
got it.
So it just is enough to keep almost like the fat from being too sticky and
Mm-hmm.
sticking in there.
Mm-hmm.
Not that it's actually how it works, but you know what? It feels like that. So,
Yeah.
one of the big things that does happen, and they actually mention it, I love this new protocol. Like, it actually makes me so happy because they mention using it
Nice.
for blebs. So, if you're getting
Oh,
like these little milk blebs or anything on it, and especially to not, they call it unroofing, but like
yep.
basically like taking the
Peel them
top
back.
off of them. Yep, I know.
Ah,
The same feeling. It's like nails on the chalkboard, the idea of that. But sometimes with, either mastitis, or if you have an inflammation process going on, or like some nipple damage, people will like pick those things off. And then it's just a perfect little pathway to introduce extra
bacteria.
bacteria and issues there and all kinds of different things. So they do mention being able to use the sunflower lecithin for that exact reason, to try and help prevent those little blebs from forming, and making sure that if you do get them, you don't mess with them. Just let them
Yeah.
be. They will go
Yeah.
away.
Yeah, those will self-resolve, where mastitis is unlikely to. Okay, you mentioned two proper fitting bras. What do we need to know about our nursing bras and tanks and pumping bras, things like that? How is that going to contribute to mastitis?
Yeah, pumping bras are a big one. Honestly,
Wow.
people will use them and they're so tight, and they're like
Mm,
just stuck in one position. So, depending on, now this is just kind of coming from my practice, but like sometimes I see that people will just stick them on, and depending on the type of pump, either the fully wearable ones, a lot of those ones do not have proper fitting flanges and they're hard to fit. But even if you had like the flanges that stick out through the bra and then attach to your pump, it basically, it doesn't allow for as much easy drainage. So if you are exclusively pumping, or if you're pumping to be able to kind of get baby that bottle, making sure that you're using like very gentle, which is the key, but hands-on pumping techniques. So moving that flange around, not just like stick it in your bra, let it go, because there's pressure that's going to be put on by different parts of the pump, and you want to be able to, just like baby, like they don't stay perfectly still for an entire feed. They use their hands like a little kitten to be able to knead the areas and all that stuff. You do want to be able to use a little bit more of a hands-on technique to free up some of the areas that might get a little bit more blocked off by having too much pressure from the way that the pump's sitting. Otherwise, I know a lot of people really struggle if they start to wear underwire bra when they're nursing, because it does the same thing. It keeps that really tight pressure up against the chest wall. But having a good fitting supportive bra when you're having a mastitis situation, a lot of people are like, wear a really, really tight bra. It's that same idea that they used to say when you're trying to dry up your milk, wear a really tight fitting bra. Don't recommend that now, because again, it increases your inflammation. So using lymphatic drainage is a really nice one as well. So really gentle, like strokes up towards the armpit from the breast. It can help to decrease the inflammation and move around a lot more of the fluid, but sometimes that can be restricted if you're wearing way too tight of a bra. So you just want something that fits really well, is comfy, use that hands-on pumping.
yeah. Wow. Okay. I don't think I have any other questions. We've talked about Tylenol and NSAIDs and heat versus cold and old protocol versus new protocol, things that increase our risk of having mastitis and things that can help mitigate those risks, what the treatments are, antibiotics, how that impacts your nursing relationship, your breast milk supply, is it safe for your baby? Is there anything that we haven't covered that you want to leave us with?
I think the only other thing that I can think of right off the top of my head is that a lot of people will use those like silicone pumps and put
Mhm.
Epsom salts or salts in
Mhm.
it, and then have it on there and like really try and pull it out with that. Now, I know there's all kinds of videos. You can see some crazy stuff coming out of like big fat globules that are stringy and all kinds of things. So it's super tempting to do. But what they find is it actually is like macerating the nipple tissue by having it in these salt soaks. So those and like castor oil packs and things, like you're not wanting to involve heat. You don't want to add this extra stuff in. You really want to stick more toward the cold side of things. So that would just, I think, be another common thing that I see or hear, especially.
Yeah, there's a lot of misinformation out there. And look, just because something's anecdotal doesn't mean it's misinformation. It just may mean that it's not the best option, right? There's best, there's good, there's okay, and then there's bad. And so we want to make sure that if you have access to the best, that you're getting the best. And so just be sure what you're picking up from friends and families, from mommy groups, from social media, from, Instagram and TikTok. Make sure that you are actually doing something that's evidence-based and also that's right for your situation. Everyone has all sorts of individual factors that play into things. So make sure you're working with a professional, someone who has lactation training in the US, or I guess everywhere. It's the IBCLCs, you have lactation counselors. Some doulas have lactation training. Some pediatricians have lactation training. Lactation in general is something that people usually have to seek out, especially. So just make sure that whoever you're working with does have kind of deeper than just base lactation knowledge. You're going to want someone who really understands mastitis when you get for this. All right, Lara, this has been amazing, so comprehensive, and also taken a topic that I think, again, we just don't talk about. And so you really don't know about mastitis until you're in it. And by the time you're in it, you're like, shit, I have this like huge lump. It's hurting. I feel like shit. I've been hit by a bus. I'm supposed to take care of this baby and I'm miserable. Give me the quickest thing. And the quickest thing is not always the best. So thank you so, so much for being here today, for sharing your time with me. If people wanted to learn from you and were interested in the course, or if there are any Canadian listeners that want to look into your services, how do people connect with you on social media and then also for private services?
For sure. So I'm at Beyond the Bump Education, and that is across pretty much social media. So I'm happy to answer any questions that you have. Beyondthebumpeducation.ca is my website, and I'm around should anybody want to reach out. I'm happy to chat about things. And yeah, I am so grateful that you had me on here today. This was awesome. I know it was like really clinical, which usually is not like this type of conversation style, but I love it because it's like, here's what it is. And like, usually I'm just way more chill about stuff. And like, this is the right info. We finally got a platform to get it out there. So, I love it. And I think it will hopefully help somebody who is listening to be able to prevent doing some extra damage that doesn't need to be done and get rid of this way sooner than later.
Absolutely. It's so encouraging to me to hear that the new protocol was better, made things better. It hit the nail on the head, it sounds like. And that just, that thrills me.
It's rare.
Guys, thank you so much for tuning in today. It has been a blast to hang out with you all. As always, I love hanging out with you guys and talking about topics that we don't get to talk about. I will see you next week. If you are listening to the podcast, head over to YouTube, and vice versa. If you're watching us on YouTube, hi, but go over to the podcast and give the episode a listen. All right, I will see you next week. Bye, y'all. Thanks for joining us. I'll see you next time on the Birth Lounge podcast. Until then, head over to Instagram and find us at Tranquility by HeHe and give us a follow. You can also check us out at thebirthlounge.com.